Everybody, good morning, good morning, good morning. Happy Thursday. Dr. Stavros here, USMLE Trainings. Welcome aboard. This is week 4 of our 4-week course. And starting next week, we're going back to again week 1. So welcome all new faces, old faces. Thank you, thank you, thank you. So typically, as you all know, we work with questions. Questions will help us see scenarios. Because the way I look at it is this. When we study medicine, right? When you study medicine, especially when you're doing content review, you're reviewing the information, you're understanding it. The problem is, most of us, including myself, I love getting hands-on and learning from being hands-on, right? But clearly you don't have that experience if you're a medical student, versus I've been out of the loop, like maybe you've graduated many years ago and you haven't seen patients since then. These scenarios that you use in AMBOSS, in UWorld, any questions that you do are clinical scenarios, right? That's all they are. They're seeing patients, because think of it as that. If you have that mentality, then you take all the knowledge that you learn, first aid, boards and beyond, online med ed, Kaplan, whatever resources you're using to review information, to obtain or reinforce the content, the basic science knowledge, whatever you're using, you have to apply it, right? The problem is many of us dry read first aid, our notes. Yeah, I know it, I'm familiar. And then what happens is you do questions and you don't do well. So this is where I come in. Every Tuesday and Thursday, we do questions together. You're here live with me, and thank you for jumping on. You can participate in the chat box and answer the questions and participate as far as provide mnemonics, or if I ask questions to spark what you know, you can test yourself. At the end of the day, there's only so much I can do. I show you the techniques to be more effective and efficient. I show you ways to utilize any resource, any QBank you use. I prefer AMBOSS, as you know, most of you know why. Some of you who are new here will eventually realize why, because I can share questions for you to you all. So typically, you can't do that any other resource, but QBank, for AMBOSS, I can create my questions that I usually do every Tuesday and Thursday, and I send them and I put them into our online community where you have access. And then you can go there and pretty much access those questions. Now, this is also recorded, so if for some reason you miss it or you want to go back and watch it again, please, by all means, you can do so, okay? I'm excited to have you all on board because today we're doing GI and behavioral science. Clearly, most of you are familiar with the information. Yes, you are very familiar. Hepatitis B, the markers, Cushing's ulcers, you have everything GIs from the mouth to the anus. So there's a lot to cover. There's a lot. But are you comfortable with the majority of information? That's what it comes down to. And many of you have access to our QBank video library, and you can watch the videos 24/7. I keep expanding the library because you could say, well, you know what? 2 hours a week are awesome, Dr. Stavros, but I want more. And that's why we're pushing hard, me and my team, to keep expanding the QBank so you have more videos of how we attack scenarios. Because at the end of the day, ladies and gentlemen, you can watch sketchy and dirty medicine. I want you to watch those videos if necessary, but you yourselves have to learn how to be better test takers, okay? I can promise you schools don't do that. They just teach you the medicine. This is important, right? That's their job, to teach you medicine. Their job is not really helping you pass USMLE. They assist in helping you pass versus sending you to different courses, saying, hey, go here, go there. But it's up to you to figure out, I know hepatitis B. I know it's a DNA. I know has an envelope. I know it's double-stranded, but hepatitis B, but I don't know more about the markers, right? So either you can watch somebody teach you about the markers, or you can watch me show you a question now about knowing what the markers mean, and then how to figure out the answer choice when you have a question, right? This is why a lot of us study, and kind of don't do well on the actual exam, or don't do well in the QBank, because you're not putting the emphasis on why did I get it wrong. I thought I had the answer, but clearly you didn't know the details, or the question tricked you. Simple as that. So this is what I do each and every session. We do our best to review a few scenarios And I hope that when you watch the techniques and the way I think, the way I process the info, the way I pull up the first aid and show you how to read the first aid, I promise you guys will be able to retain a lot more. Please do not, and I'll repeat this again, please do not study for this exam like you do when you study in med school. It's not going to help you. It just makes sense, right? It does actually make sense because in med school, you're studying for a particular system or topic, biochem, a final in microbiology, a final in immunology, a final in neuro. This exam is two years in medical school, a year and a half, 2 years of basic sciences, all crammed in one exam. Plus, they have experimental questions. So if a little tip before we begin, if you all have issues with endurance and stamina and staying consistent, especially when they're timed questions, I would suggest after studying for a while, if your test is coming up in a month or two, you should start doing timed blocks and practice staying consistent and having your endurance and being able to be having your stamina tested. Because many students, what they do is they study and they do a block or two each day, but then the test is 7 blocks of 40. So I don't know about you, but if you take an 8-hour exam and you don't practice sitting there at least 4 or 5 blocks of 40 timed to practice the run, you're going to run the marathon, you're going to burn out halfway through. Many students take the test, and every so often by the 4th, 5th block, they start dropping their score because they're running out of energy, running out of gas, so to speak, and then they can't finish the race, or they finish, but they don't do well. So please take my advice, study as long as necessary, use a QBank, use your content builder, and then eventually say, can I sit and do 4 blocks of 40 times with 5-minute breaks in between? If you can't do that, you won't sit and do 7 blocks of 40. I can promise you. Very few people can actually have done that before and done well without practicing. So just to summarize, before you run the actual race, which the marathon is 23 plus miles, 23 something, you should try to run at least 10 to 15 miles.